Tonight's big story. Official data released to Newshub has revealed woeful staffing levels in our emergency departments. We're short more than 100 ED nurses, and wait times have blown out, with many patients facing 6-hour delays in corridors and waiting rooms. Emergency departments are supposed to be for medical emergencies. Instead, they're at the forefront of staffing emergencies. Figures revealed on Newshub Live at 6 tonight show hospitals across Auckland are short 50 full-time emergency department nurses. 25 are needed at Middlemore ED alone. In Waikato, the shortfall is 15. In the capital, 35 across Wellington and Hutt hospitals, and Christchurch needs 12 ED nurses.
This has been coming for a long time. Decades. The presentations are predictable with population growth and increasing comorbidities of patients. It's not just a post-pandemic blip.
In 2015, more than 90% of ED patients had been seen, treated and admitted or discharged within 6 hours.
Now it's all over the dartboard, and some people are lucky to be seen within 6 hours.
The minister's touting a 45% increase in the health budget, a $7 billion hospital rebuilding program, and plans to train and retain more health workers. In the meantime, the health system still appears to be in pretty poor health. For more on this, we're joined by Paul Golter from the New Zealand Nurses Organisation. Kia ora, Paul. Thanks very much for coming on with us tonight. How significant is it to be down this many staff in emergency departments?
Oh, it's incredibly significant, as any person who's tried to get close to an ED anywhere in the country knows. But I think the point is, it's not just emergency departments. This is right across the hospitals and right across primary health, aged residential care. This is everywhere. And whilst it's acute at the point of emergency departments, right across the motu, everyone's suffering from this issue.
The Minister has talked about significant investment. Have you seen anything that gives you hope things will improve?
Well, you know, we're still thousands of nurses short in this country, and people are talking about doing this and doing that, but ultimately, right now, our nurses are at the front line, feeling the pressure of under-resourcing and understaffing, and this is a real health and safety issue now.
To that end, we've also seen hundreds of nurses at 3 private hospitals striking today. What is the latest there?
Well, this is remarkable. This nursing crisis, which we call a health and safety crisis, is now spreading into the private hospitals. And so we had a great group of nurses standing outside 3 private hospitals under one chain today, asking for both wage justice and recognition of the legitimate claims.
Have they made any progress on that front across nursing?
Well, we tried mediation yesterday. That got absolutely nowhere. In fact, that just infuriated these nurses more. Because fundamentally, what lies behind this is nurses are asking to be respected, not just told, we respect you and we think you're great. What are you actually going to show them? And I spoke to a lot of nurses on those rallies and pickets, and that's what lay behind them. They said, why would our employer want to pick a fight with nurses right now? I thought we were all in this as a team. And this is what happens, that suddenly they're outside the business picketing it.
Yeah, somewhere where they never thought they would end up. So what advice, though, would you give anyone, viewers out there tonight, who need to visit an emergency department and they're going to be worried they're not going to get the help they need?
Well, obviously, if you're acutely unwell, you need to get there. But we'd like to also think if you can try your primary health provider, that would be really great. But ultimately, if you need to go to an emergency department, it's going to be tough to get there, but you've got to get in there and be prepared maybe to wait a while longer. But the point is, if you need that care, our nurses will do everything possible to give it to you.
Paul, thanks very much for your time tonight.
Cheers.